Obstructive sleep apnea occurs when an individual's breathing passages are blocked or obstructed, and this causes the person to stop breathing multiple times throughout the night. And these pauses in breaths may only occur for a few seconds, but if they are occurring multiple times throughout the night, this can lead to many health concerns. Now, obstructive sleep apnea is often overlooked, but it is a serious health condition as it can lead to further chronic health conditions such as heart disease, stroke, high blood pressure or hypertension, diabetes, memory loss, and all of this can contribute to a higher mortality rate. Now, some risk factors for this health condition include being male, being over the age of 40, having a large neck circumference, so for a male that is 40 centimeters around the neck, and for females that is 43. And the biggest risk factor is that those who smoke are 3 times at a higher risk for developing sleep apnea than those who do not smoke. So as you can see, sleep apnea is a really serious health condition because it has a negative flow-on effect to these other chronic health conditions that do have a really serious impact on your life. Now, getting a diagnosis, you will need to see the relevant health practitioner, but it starts with your GP. And from there, you will often be sent for an overnight sleep assessment where they can determine how many times a night you stop breathing. If you're diagnosed with sleep apnea, you'll often then move on to a CPAP machine. And this machine just helps to provide steady and constant air and pressure in and out of your nasal passages, enabling you to sleep throughout the night without those obstructions or those blockages, which occurs when you have sleep apnea. Now, how can an exercise physiologist help? Well, as an exercise phys, we are specifically trained in prescribing and delivering exercise for all of these chronic health conditions that we have listed. So exercise has the ability to act as a dose of medicine to reduce the risk of developing many of these risk factors such as heart disease, stroke, diabetes, and it also helps in reducing levels of obesity and reducing weight, which again is a massive risk factor when determining your risk of developing sleep apnea. So if you've been diagnosed with sleep apnea, it's really important you talk to your doctor and from there seek guidance from an exercise professional to help use exercise as a way to reduce your risk of developing many of those chronic health conditions.